Hong Kong also bracing for mass people movement across the border with mainland China. The city's online registration system for travellers going to the mainland crashed within the first hour of its launch. And more than 250,000 people were able to book places after service was restored hours later. From Sunday, up to 60,000 people from the city will be allowed to cross to the mainland every day, quarantine-free, and vice versa. Meanwhile, hotels and private clinics in Hong Kong are gearing up for the reopening as the city tries to balance economic and public healthcare needs amid rising COVID-19 deaths. Deborah Wong tells us more.
Border restrictions between Hong Kong and China will be lifted in phases, marking the slow recovery of cross-boundary travel and a more optimistic outlook for the hospitality sector.
With the recent announcement of the easing of COVID-19 guidelines for mainland tourists, we have received further inquiries and bookings from both the business and leisure sectors.
Most industry players say they welcome China's reopening, as it will inject much-needed yuan into Hong Kong's pandemic-stricken economy. But because of China's ongoing COVID surge, most are also taking precautions. Like this hotel. The hotel will not operate at full capacity for now.
This measure includes deep cleaning, sanitization of rooms upon guest departures, and continuous service procedure for COVID-positive guests who opt to stay with us until recovery. We also have regular sanitization procedures for all public areas and restaurants. All our team members do standard RAT tests and will conduct extra PCR tests and RAT tests in case of close contact with COVID-positive guests.
The hotel will not operate at full capacity for now, to allow housekeeping staff ample time to disinfect rooms thoroughly between service. All staff are also vaccinated.
It's a precautionary measure that more Hong Kong residents are turning to after initial reluctance over the last 3 years. This Wednesday alone, about 18,000 residents took their vaccination as the clock ticks down to China's reopening. It's a huge increase from the 2,000 daily jabs earlier last month. And this also comes as Hong Kong marks increasing number of COVID-19 deaths after rolling back most of its social distancing curbs.
Only residents can get vaccinated for free. Private healthcare providers offer paid vaccination for non-residents. That supply is separate from the one for residents.
It is kind of a market decision. If a doctor wished to buy some of those vaccines and he suspects there would be some overseas people coming for the vaccine or from the mainland, then certainly he can try. But then there's no guarantee that those vaccines can be fully utilized.
As for concerns on dwindling fever medicine supply following reports of stockpiling,
we have stringent border control, and the regulation is that anyone leaving Hong Kong can bring along with him a small amount of medicine for his own personal use, and that amount has to be reasonable. If someone is taking, say, 10 or 20 boxes of those medicine, then the immigration will consider that it's a possibility that the purpose of taking those medicine away is for sale, and that would be against our law.
Ahead of the reopening, the hospital authority has shifted gears to focus on prioritizing treatment and protection for higher-risk groups, such as the elderly and young children. It's also amped up the local and backup supply of fever drugs to ready for any surge in cases. Deborah Wong, CNA, Hong Kong.